Fellow Barbadians, residents and well-wishers, a pleasant good afternoon to all. First, let me convey on behalf of the Honourable Prime Minister, the government and people of Barbados, sincere condolences to the family of the late Joe Edgell, former Member of Parliament and former Deputy Speaker for the constituency of Christchurch West Central. I had the good fortune a few months ago of officiating at a ceremony in Gall Hill in recognition and honour of the service of Mr. Joe Edgell, and I can attest to the high esteem in which he was held by the people of that constituency. I'm sure that at the earliest opportunity, a thorough tribute will be paid to Mr. Edgell by the Parliament of Barbados. To his wife Angela and other family and friends, we express sympathy and God's richest blessing on this sad occasion. Fellow Barbadians, since this country has started preparations for COVID-19, the government has repeatedly stressed that we are dealing with an evolving situation that would require constant review of our response plan as the scientific evidence and behavioral responses of the population emerges. On occasions, our reviews have resulted in the tightening of the regime of restrictions, while on others, we have been able to relax the rules without compromising the public health guidance and advice that has always underpinned our decision-making. Over the weekend, and certainly today, the Cabinet of Barbados, the Emergency Organization Committee, as well as the members of the parliamentary group, have been examining the effectiveness and continued necessity of a number of the measures that we have outlined over the course of the past few weeks. And we have agreed today to the following changes. Effective immediately, gas station operators will discontinue the use of the alphabet system of surnames when it comes to the purchase of fuels such as gasoline, diesel and kerosene, liquefied petroleum gas, as well as cellular top-ups. Grocery shopping at supermarkets and mini-marts may now start at 7 a.m. and run until 4 p.m., while maintaining the previously mentioned break at 11 a.m. However, we've advised the supermarket operators that they can continue to process the shoppers who are at the lines in the queues at the cut-off times. In light of the public holidays on April 28th, Heroes Day, and May 1st, May Day, individuals who would have been permitted to shop on those days using the alphabet system will now be permitted to shop during the times allocated to essential workers next week only. That is on Sunday, April 26th, between 11 a.m. and 2 p.m., and on Thursday, April 30th, between 1 p.m. and 4 p.m. These time slots have been selected based on the feedback from the operators of the various supermarkets, who note that the shopping traffic for these particular categories has been quite manageable at those times. Given the steps now being taken to utilize online teaching while the country fights COVID-19, as well as the growing number of workers who are operating from their homes, computer stores will be permitted to open to facilitate online shopping for computer equipment and peripherals, such as ink, paper, the cables, and the other items that are connected to the use of devices. Customers will only be allowed to access their purchases via curbside pickup using the alphabet system, and operators of computer stores will also be facilitated to do delivery. There will be absolutely no in-store shopping. All Barbadians are reminded that a strict curfew remains in place between the hours of 6 a.m. and 6 p.m. Except for essential services, movement during the hours 6 a.m. to 6 p.m. is allowed only for permitted activities such as essential shopping or banking during the allocated periods based on the alphabet system, to purchase petroleum products or to seek medical or dental attention. The maintenance of the regime of restricted activities is critical if we are to continue to record favorable results in our efforts to halt the spread of COVID-19. On the matter of education, and more specifically the resumption of formal teaching or learning in the primary and secondary schools, Barbadians are asked to note that while there have been extensive discussions with the various stakeholders all last week, the situation is still relatively fluid to make it unwise to stipulate a precise start date for the new term. Already, though, some of our teachers, in consultation with their principals and other stakeholders, have begun using the available online resources and technology to better familiarize themselves and their students with the technology and environment. And they will be using this, obviously, to a greater extent in the future. Our aim is to have this emergency response mechanism in terms of our technology rolled out in all schools once the circumstances permit. During this familiarization period, teachers, rather than introducing new concepts, will use the opportunity to reinforce those subjects taught in terms 1 and 2, respectively. This will allow the approximately 80% of teachers who have already been trained by the Ministry of Education and through its ITC coordinators to use the new technology, and to be able to test this learning while allowing the ministry to facilitate the training of the remainder of our teachers in the system. It will also give us the opportunity to be able to work with the Caribbean Broadcasting Corporation as well as the various radio stations to provide a number of messages to the public and in particular to our parents to allow them to feel comfortable allowing their students to be able to use this new platform. In the Ministry of Education, Technological and Vocational Training, like the other stakeholders, we recognize that not every child or household has access to the necessary equipment, internet connectivity, or even electricity. But we're working with these various service providers and or overseas suppliers to address this in the shortest possible time. We recognize too that a number of individuals and entities have actually already offered to assist with the donation of equipment to ensure, as much as is possible, a leveling of the playing field. And we're moving with haste to set up the mechanisms to process these donations. On behalf of the Ministry and of the Government of Barbados, I want to extend sincere thanks to these persons and also the entities that have been assisting us in this process so far. We know that it has not been an easy task in terms of the past few weeks, but we certainly have been appreciative of not just the retailers, but the manufacturers, all of the various stakeholders, and indeed the public as well, for being able to be patient at times, even if the tempers start to flare at times, but for the most part being patient in respecting the guidelines and the directives that have been given by the government. With me this evening, I also have the Honorable Lieutenant Colonel Jeffrey Bostic, Minister of Health and Wellness, and I believe that given that we have had 5 days recorded straight of no positive cases, that this is an appropriate time for Mr. Colonel Bostic to be able to speak to the country as to the status of healthcare in Barbados in relation to COVID.
Thank you, Acting Prime Minister. Good afternoon, all. I am happy to report that 4 more persons will be released from isolation today after testing negative for the coronavirus that causes COVID-19. For the 5th straight day, there were no new cases reported in Barbados. The 4 persons who tested negative for the 2nd time yesterday were among 28 negative test results returned by the Best Dos Santos Public Health Laboratory. This brings the number of persons who have recovered from the viral illness to 23, while 47 others remain in isolation. A total of 75 persons have tested positive for COVID-19 since the first cases were diagnosed on March 16th. Of these, 5 have regrettably died. Since February 11th, the Public Health Laboratory has conducted some 1,063 tests. The fact that we have recorded 5 days without any positive tests, I believe is testimony to the outstanding effort that is being given by those public health officials who are working in the communities doing contact tracing. It also is a result of the level of cooperation and support that we've been having from the general public, those persons who have been presenting themselves with symptoms and those persons who have simply been cooperating in following the public health advice that we have been putting out over time. But I want to reiterate that although this is indeed very encouraging for all of us, it is not a sign that we are out of the woods. We must not drop our guard. We must not drop the level of defense that we are putting up against this enemy. Should we decide to drop guard, Barbadians and residents, that would be a sign that we are retreating. And as I've said before, no retreat, no surrender. Ever since we started testing, we've had to manage the resources that were available to us. And we would have started several weeks ago with about 500 tests available to the laboratory. As a result of that, we've had to be very, very careful in terms of how we utilize those tests, and we established some fairly rigid criteria for persons who would qualify for a test. I am happy to say today that from the paltry figure of 500, we now have available in this country 27,000 tests. Now, we have been working assiduously to ensure that we cover all eventualities, including the provision of quarantine and isolation facilities. I would have said yesterday that although there have been a reduction in the numbers of persons being tested, and yes, we have had some challenges with the availability of swabs, we were still testing persons, approximately 32, 33 for the past 4 or 5 days. I would also have indicated yesterday that one of the things that we would like to do, and as quickly as possible, is to be able to escalate the amount of testing that we're doing, but we were hampered by the inadequate number of swabs that we had available to do the tests. But testing has been going on, and the only reason why the numbers have been reduced is because we were not having the numbers presenting with symptoms as we were having before. So that the testing site at Paragon has not been seeing the same amount of persons. There's been a reduction, significantly so. And there's also been a reduction of persons being referred from private medical facilities across the length and breadth of this country. I'm happy to say today that as of midday, the Ministry of Health and Wellness has been able to secure 2,800 swabs, which significantly increases our capacity to escalate the testing that we're doing across this country, and we will do so in short order. We are going to revise the testing criteria, and the Emergency Operations Center will put out a new document that will be sent to service organizations such as our councils, Medical Council, Nursing Council, Barbados Association of Medical Practitioners, and to all other stakeholders, including pharmacists and pharmacies, so that we are all on the same sheet of music. And we will also be listing shortly a number of centers which include the existing polyclinics where you will be able to go to have those tests done. And I can say for right now that in addition to Paragon, we've also been able to establish a testing center at the field medical facility, which is located on Gemens Lane at the old Ministry of Health site. So details will be published later, but suffice it to say that the Ministry of Health and Wellness intends to widen the scope of testing, including the number of persons that we will test on a daily basis. We will do so because we want to be absolutely certain that there is no community transmission in this country, even though at this stage we have seen no evidence to suggest. But out of the abundance of caution, that is the direction that we want to be able to go. I'm happy also to report that as of yesterday, the Harrison Point Isolation Facility was stood up and received its first 3 patients. Those patients were transferred from the isolation center at Enmore, and today the process started for persons to be transferred from Blackman Gall up to Harrison Point, and that will be ongoing throughout the week because it is a fairly delicate procedure that has to take place, and we are doing so very, very carefully. So we'll take our time to make sure that we get those persons transferred to Harrison Point as soon as is possible. The intent is to fully utilize the Harrison Point facility. We have the staffing for that facility, local staff as well as the nurses from Cuba who have been put into operation from yesterday, and we will continue to operate that facility. Fortunately for us, even though we have not been able to receive the number of ventilators that we have already purchased from abroad, we have sufficient ventilators, enough ventilators on island that would allow us to be able to deal with what presents before us right now and also what we anticipate in the very near future. And we are in the fortunate situation at this point to have one patient only on ventilator. And we've been very fortunate that we've had persons who have been or were on ventilators who have been taken off ventilators. And in one case, one person who was on a ventilator has been removed from isolation. So I believe that we should really congratulate all those persons who have been involved in this process over the past several weeks as we continue to render the level of service as required of the Ministry of Health and Wellness and all of its partners, including those in the private sector, to arrest this situation with COVID-19, and as I said before, to unite to fight against this virus.
Thank you, Colonel Bostic. Again, I want to just commend, I think, on behalf of all Barbadians, the entire health team and certainly the Minister for the stewardship and the leadership that they've shown thus far. I think we have some positive results. And it's nothing, as he said, just to reiterate, we are not going to become complacent. We're asking Barbadians not to be complacent at this time, but again, to allow the medical authorities to guide this process so that we can all get through this and resume normal activities. I'm going to open the floor to questions from the media at this point.
Good afternoon to you, Acting Prime Minister Bradshaw. Wendy Burke here, Starcom Network News. I am sure that individuals are happy to hear about the gas stations and how they will now be run. Outside of the gas stations, is there scope perhaps maybe for, say, or fast food restaurants to go to a limited service or drive-through only?
We are considering all options, but I think at this time, as you can appreciate, we have to obviously rely on the medical authorities to guide us in this process. Because we've had 5 days of no positive cases, we don't want to start to just open up the country because of it. And so we're going to be guided by them in terms of the types of operations. I can tell you that we have been in discussions looking at what happens post May 5th. With a view that we can determine, obviously, depending on what the results show at that point in time, and if the medical authorities are satisfied with the position of Barbadians at that point in time, how do we start to obviously free up some activity across the country? But in all of this, we will be guided by the public health officials in making those determinations as to what measures we will free up for the country.
Okay, follow-up question to that. The business community had been asking as well for a little relaxation, and we've heard of additional hours and so on at the supermarkets that will help out the elderly. What about the time frame that they've also been asking for, where their staff could be allowed additional time at night to restock the shelves?
Right, we have been in discussions with them, and the committee has accepted the recommendations. I haven't actually had the opportunity to convey that to the association, but our intention is to give them some latitude to be able to allow the repacking of the shelves, because we recognize that given the window of opportunity for persons to shop, even though they've made the necessary arrangements during the day to facilitate persons doing the shopping while persons are, doing the packing while persons are shopping, there is still a period, obviously, at the 5 o'clock time frame for cutoff, that they have to get the supermarket cleaned and the shelves repacked, and obviously get their employees home. So we're mindful of that. So we will be speaking with them about the time frame, but it is definitely a point that the committee has recognized, and we are open to allowing that opportunity for them.
Thank you so much.
Okay, I'll turn up your
Good afternoon, Madam Prime Minister. This is Ian Bourne, both CETA Radio 90.1 FM and BeijingReporter.com. I was, first of all, like to praise the Vulnerable Families Initiative, which is allowing for certain affected individuals to have an unemployment buffer. But I am aware of the fact, as most Barbadians, that also tourism and, in fact, crop over itself have been taking a big hit. Vulnerable families does not necessarily apply to, say, stewards, stewardesses, and catering in the airline industry, nor would it apply to ancillary staff of crop over. Is government going to seek to do, whether by itself or as a public-private initiative, to look to address ancillary workers in both tourism and what would have been crop over 2020?
I think, Ian, you know that both the substantive Prime Minister and myself have been, and the Minister of Culture, have been very entrenched in this particular area, both as representatives for and ambassadors for the country, but also representing artists. And at the very early outset, the Prime Minister would have indicated the allowance of funds to be able to assist this particular sector. Truth be told, the discussions are ongoing regarding a training initiative, which a lot of the monies that would have been allocated to crop over will now be placed into an initiative to be able to allow a number of the artists, musicians, persons in the creative industry to be able to benefit from that fund through training. Because we recognize that when we come out of this period, that they still have to be able to be equipped to prepare for the next year's crop over. And therefore, there are a lot of entrepreneurs as well that have already approached the Minister of Culture and the NCF with a view to having a number of events online. And I think the public can stay tuned for those opportunities. With respect to the tourism sector, we had extensive discussions with all of the stakeholders, with the Honourable Minister, Kerry Simmons, and they expressed a number of concerns, as most other Barbadians are very worried about what will happen over the course of the next few months. There are a number of proposals that are on the table, but we've started to look at training as well for a number of persons in the hotel sector. So those discussions with the tourism sector are ongoing, and we've given the sector a bit of homework to do and to come back to us so that we can make some final decisions in relation to the tourism sector.
And one other issue I wanted to bring up with you would be your previous status in that of educational and vocational training. I know in Cayman Islands and in Trinidad, they're considering starting the next term in September. I was wondering if Barbados, even if we do reopen on May 4th, would be looking at that possibility, and also what is the initial theory towards the 11+ for this year?
We're exploring all options right now. I think the situation today is far different from what it was a couple of weeks ago when we first suspended the classes for term 2. We obviously are watching what is happening across the region and certainly across the world. In relation to CXC, for instance, obviously that is governed by the regional body, and obviously they have made some recommendations in terms of when they would want students to sit the exam in June to the July period. However, we're mindful that as cases increase across the region, or if other territories are not able to control their numbers, that will have a direct impact on Barbados as well, and we may very well find ourselves moving to September. What we've spoken to the respective stakeholders about is that this situation is fluid. We've expressed that there will be a point where we will certainly know that we may have to postpone it, but we intend to continue to engage in the dialogue with them with respect to any shifting from the June-July date, obviously, to a September examination period. The common entrance exam, obviously we have more control over that because that is obviously a creature of the Barbados government and the Barbados educational system. We have initially said that we would postpone until the end of June, but that is still subject to review, obviously, after the 4th of May. And those discussions are ongoing as well with the various stakeholders in terms of the best time. It may very well be that we will have to postpone the exam beyond the June period, but at this stage, it's still a bit too early to say with any degree of certainty. What we are trying to do is to ensure that students who are preparing for exams at any level, that they're not obviously disadvantaged. We're trying to ensure that the issue of devices is something that, and the access to devices and obviously electricity and Wi-Fi connectivity is something that the ministry has been engaged in discussions with stakeholders so as to try to ensure that no child basically is left behind in this process, because we're mindful children are coping with having to adjust to this period. Parents are having to adjust to this period, and ordinarily the examination brings with it a certain level of anxiety on all stakeholders. So particularly in this environment, we don't want to do anything that is going to disadvantage any student at this point in time. But we've had very fruitful discussions with the unions, and I'm really grateful to them for taking the time to meet with us as well. We even met with the private principals of the schools, private schools principals, and generally there is a willingness to continue the dialogue, to be able to look at all the options and then allow the Ministry of Education to make the respective decisions relating to any shift in the actual date.
Thank you.
Good afternoon, Prime Minister, Acting Prime Minister Barry Allen here
Good
from the
afternoon.
Nation newspaper. Yeah, my question is for the Minister of Health and Wellness, Lieutenant Colonel Bostic.
Yes, thank you.
Hi, good afternoon, Minister.
Good afternoon.
Yesterday, spoke to my colleagues. You did mention that we did have one frontline worker in Barbados who had been compromised, but there was little information otherwise coming out. And there is some details we would appreciate if you could provide regarding that compromise. Can you indicate if that frontline worker was a public health official? And if so, if that person, in the midst of them being exposed, if they were wearing personal protection equipment or not, or if there was any negligence involved from either that public health personnel or from the patient who would have been being screened at the time. Is there any information at all you can give us regarding the compromise of that frontline individual?
Well, I can't give you any information regarding the compromise, but what I can say to you is exactly what I've said, that we have had one case, and we have treated to that case in the same way that we have treated to all confirmed cases, because there is a level of confidentiality that we exercise, and we will continue to exercise that level of confidentiality. That particular person has been managed in the same way that we've managed all of the other cases, and that particular individual is in very stable condition, and we don't have any issues in relation to the person. We've done the necessary contact tracing and all of the work that we would normally do for a confirmed case.
And my follow-up question, Minister, is can you give an indication of eventually how many patients you expect to have at the Harrison Point facility within the next 48 hours or so? Are you going to move all patients there within the next very short time frame?
We are aiming to move the patients from the Blackman Gollop facility, and we started that process today, as I would have indicated. And we want to do so in as short a period of time as possible, but recognizing the fact that it is a delicate operation, and there's no time frame or time limit to it. The point is that the outcome is going to be that within as short a period of time as possible, I would like it to be this week, we will be able to move those patients from Blackman Gollop down to the facility at Harrison Point, which is adequate enough to take all of those patients who are in isolation across the country.
Can you tell us how much, though? Do you have a number?
In terms of the facility you're speaking of? Or?
No, in terms of how many will be transferred, how many you're going to move within the next few days?
Blackman Gollop is about 37, I believe. So there are 37 patients there who will be transferred over the next few days. And it started this morning.
Thank you.
You're welcome.
Hi, good evening. Randy Bennett from Barbados today. My question is also for the Minister of Health.
Okay.
Yes, sir.
Hi, good evening, sir.
Good
You
afternoon.
mentioned that the ministry was they now had 2,800 swabs and that they'll be raising the testing criteria. Can you tell me if, I know the government had mentioned earlier that frontline workers would only be tested if they show symptoms. Can you tell me now if due to this, the one case of the health worker having tested positive, can you tell me if government will move towards testing frontline workers more frequently?
Well, first of all, let me say that I never said it was a health worker, but a frontline worker. So let me make that point abundantly clear. And secondly, the information relating to the testing protocols that will come out will be issued by those persons who are technically competent to take care of those matters. I try to ensure that my technical officers who are paid by the country to deal with technical matters take care of those. So that information will be forthcoming as soon as we have been able to put that program together. But it is being worked on as we speak.
And will that include frontline officers being tested more frequently? I know the government had a stance on that before.
We will test whoever is required to be tested. It may include frontline workers. Basically, we intend to broaden the spectrum of persons by the criteria that will be established and sent to the various stakeholders.
Hi, good afternoon, Minister Bostic. This is Michael Phillips from the Barbados Advocate. Just trying to get an idea. I heard you mention that there were 1,063 tests conducted, and I assume that some of those would have been retests. And so, can you give us a number of how many persons in total have been tested?
It is going to be difficult to really make the distinction at this point in time, but generally speaking, 1,063 or whatever the number is, that represents persons who would have taken the test.
Okay, and to follow up, you had stated that there were persons tested over the last 5 days, the last 3 days. How many of those persons would have been tested through contact tracing?
Most of the persons that we test are tested through contact tracing, with some being referred, not necessarily through contact tracing, but referred by institutions to the testing center, in particular at Paragon. Since we've started, for example, of the 75 cases that we have, confirmed cases, about 31 of those would have resulted from contact tracing. 31. And we would have had just under 400 persons in quarantine and monitored as a result of contact tracing. We've established a very rigorous contact tracing regime because we recognize that even with a lockdown and the testing and everything that we do, the key is for us to be able to identify those persons who would have come into contact with confirmed cases, locate them wherever they are, quarantine as necessary, and in some cases, as we've had to do, isolate. The faster we get to those contacts, the better this country will be in terms of being able to fight this virus. And that is why I've said earlier that the signs are encouraging. We've been on top of the game, but we know that we are not yet out of the woods because we are still pursuing some other contacts and doing some other work that is absolutely necessary. But the contact tracing has been bearing fruit.
Okay, thank you very much.
You're welcome.
Lieutenant Colonel Bostic, don't move quite yet. Based on this rigidity that you're saying you're now going into and having all of your technical people ensuring that they're on the ball, how much of what they're doing now is based on the modeling which the epidemiologists would have done?
Right. What we are doing right now is based on what is actually before us and what has been before us over the last several weeks. So, for example, as I indicated earlier, when we had a limited number of tests, we had to make decisions as to how those tests were going to be utilized, especially with the international issues in relation to medical equipment and the exportation of equipment from places that we would normally have purchased from. We had to be very, very prudent in how we manage those resources. And so we would have tested based on people who would have satisfied a particular criteria. For example, you would have recalled that we would have stated several weeks ago that persons coming from hot spots, arriving from countries where there's a prevalence of COVID-19, that those persons would have been put into quarantine, and we would have monitored those persons, and based on symptoms presented, then we would have isolated and tested persons. The positive cases remain in isolation, those negatives were allowed to go. Also, we would have been getting persons referred from private medical facilities and practitioners. Those persons would have been referred to the testing center, and we would have been testing those persons based on the symptoms presented, etc. All I'm saying now is that we are widening that gap because we have more resources, and we will be indicating to the country very, very soon exactly how that process is going to work, but we do not want to do so before we're able to make contact with our stakeholders.
Any idea as to whether or not there will be an ease on the equipment that we're currently waiting on, or are we trying alternative sources?
Some of the equipment, some of it has started to arrive, including kits, PPEs, a few ventilators, swabs, testing kits. So bit by bit, things have been coming in, and thanks to the team that have been put together by the Honorable Prime Minister, we have people who are working round the clock, working all angles and all avenues to get equipment here, and that has been working. And we are beginning to see some light at the end of the tunnel, and we are feeling in a more confident position right now to be able to deal with what is before us.
Thank you.
You're welcome.
Colonel Bostic, I was wondering if there was any plans for the Cuban medical personnel that even after this stage passes, if they would be providing any of their expertise in the form of training for local doctors and nurses.
Let me say that the Cuban personnel who are here for a specific purpose at this point in time, which is to provide much needed assistance, HR assistance to the government of Barbados through the COVID-19 isolation centers, and that process has already started. But be mindful of the fact that the government had negotiated an agreement with the government of Ghana for the provision of nurses from Ghana, and up to 2 to 3 days ago, I was able to speak on a video conference with the Minister of Health of Ghana, and that process is still very much with us, and we anticipate that we will hear from Ghana sometime during the course of this week in relation to the date of travel of nurses from Ghana who are coming to work in the hospital and in our primary health care facilities. And that is really what we are doing in relation to those two sets of medical personnel from those two countries.
And one other thing in terms of caring for those not so fortunate, specifically in the capacity of the elderly, what is the level of progress in processing applications for the state of emergency passes for caregivers that wish to look after elderly members of society?
That one will be addressed by the Honorable Acting Prime Minister.
Thank you, Ian. I think as we would have said a few weeks ago, we've been compiling the list of the persons who are elderly, who are most vulnerable. I know that the Ministry of People's Empowerment, they are working in Welfare Department. They're working very closely with the czar on this project. They've been identifying those persons who are already in the system, but also reaching out and trying to trace those elderly and vulnerable families. I believe the Cubans as well are working with the Ministry of Health as well to assist in that regard with our healthcare workers to be able to help identify those vulnerable elderly persons. So there's a plan in place to be able to root them out and be able to address them. I think the biggest concern has been that a number of our elderly have presented late to the medical services, and in some cases it has been too late when they have presented with signs of COVID. As a consequence, we've been very aggressive in trying to go after them, and I really would want to take the opportunity to appeal to Barbadians to really be your neighbor's keeper at this point in time. If there are elderly people in the community, maybe not necessarily going to the house, but perhaps giving a call or just trying to find out if there's any way that you can assist. Even in relation to going to these supermarkets, obviously we want to make sure that we don't have 4 or 5 persons going to the supermarket with an elderly person, because again, they are most vulnerable, and we need to be sensible and we need to be practical in the approach to things like shopping. But as much as possible, I think we need to look out for that vulnerable category, and from the ministry's end, we certainly are trying to ensure that we can find as many of them as possible at this point in time.
Yes, but you had a specific email for an application for permission, caregivers@barbados.gov.bb. A lot of people have applied and they're yet to receive acknowledgement.
Those are still being processed. As you can appreciate, the requests are coming in, but the ministry is obviously dealing with the requests as they come in. So just like we've had to deal with the emergency passes for other workers, it is an arduous process, but I believe they are grappling with the situation and they're trying to put as many resources in place to deal with it as well. It's obviously a difficult one, Ian, as you can appreciate, because persons will say that they're looking after an elderly person sometimes when they're actually not. So the department has had to do a little bit more investigation to ascertain the truthfulness of some of the applications as well. So we just encourage people to be open and honest about the level of care that they're really providing, and not seek to find a loophole in the system in order to try to apply just to be able to leave the house under the guise that they're doing something for an elderly person. But the ministry is dealing with those applications as we speak.
Acting Prime Minister, the last time the Prime Minister spoke to us, she did mention that in about 10 days or so, based on the information she had passed on to her Ministry of Finance team, that we would expect to see some national insurance scheme payments start to be disseminated. Can you give us an update on that?
The National Insurance Department has been working on processing that information. I believe the first set of checks should be issued shortly. But as you can appreciate, it's a lot of persons. There are far more people who are now unemployed than would ordinarily be so. And therefore, we've had to increase the number of personnel in the department in order to be able to accommodate the processing. We've also looked at different mechanisms in terms of how to deal with the payment. So between the NIS department and the Ministry of Finance, they've been working through those details, but the funds certainly are available to those persons who qualify. We've also asked for the employers to also cooperate in basically filling out the information as well. So that, again, is an ongoing process at the moment.
Can you give us an approximation of how many thousands of applications you've seen? Because it would have increased in the last 2 weeks, I would expect.
I can't give you a precise number. I know we started a few weeks ago at about 12,000, but I believe we are creeping well over 30 or so thousand at this point in time. And those numbers, I believe, are expected to increase. Again, that's why we are working so hard to try to keep the numbers down and to ensure that Barbadians adhere to the curfew restrictions and to the directive, because should we drop the ball on this, it will obviously have very, very deleterious consequences for the entire country, and certainly prolonging of the period under which we are presently under curfew under this directive.
And just one quick follow-up to that, the Prime Minister had also mentioned the treating of the vulnerable with the funds that will be expected to be disbursed to them as well. Are we any closer to that process being started?
My understanding is that the top-ups have actually been done today. They've been working on that over the weekend and certainly late last week. So I believe persons should be starting to receive those vouchers within this coming week.
Thank you.
I want to thank you all from the media for your questions and certainly for continuing to help us in the government to be able to spread the word about the dangers of COVID and certainly to disseminate the information. I want to ask Barbadians to really continue to heed the warnings that have been put out there by the health officials, but also to thank all of the various stakeholders at this point who have been, bending over backwards to try to find ways to make the systems work. I've said before, this is not a perfect system. It's not a perfect environment for any of us. We're working hard and listening to all of the concerns that have been expressed by the people of Barbados. Sometimes it's not easy in terms of the decisions that we make, but I assure you that we're doing all that we can in the best interest of the people. And therefore, as we've said before, we will listen. We will make the fine-tuning to the directive as we see fit. But the one thing we will not do is we will not drop the ball on this initiative. It is not by chance that the current leader, the substantive leader of this country, has been heralded for the management of this crisis. It is not by chance, and her leadership within CARICOM. And I think Barbadians, in the midst of all the concerns and all the heightened awareness and the anxiety, would do well to bear that in mind, that Barbados right now has handled this crisis well, and it really is our reliance on you to be able to continue to help us to punch above our weight through this crisis so that we can get back to business as quickly as possible. So I thank you and good afternoon.